Good evening, and thank you for joining me this evening. My name is Paul Holt, and we will be discussing periodontal disease, or what is commonly referred to as gum disease. It is possible to have gum disease and not even know it. Even now, this common form of infection is working against you. But the good news is that you don't have to lose your teeth, because periodontal disease is controllable. So tonight I want to discuss with you the various forms of periodontal disease. I want you to know the enemy. Gum disease is common and aggressive, but we can also learn how to bring periodontal disease under control and make it manageable. And we'll have some strategy for how to successfully deal with gum disease. So first we need to know what we're up against. It's always a good idea to know what you're facing in order to know how to defeat it. So over 50% of the adult population has some form of gum disease, with 10% of that population having the most serious type of gum disease, periodontitis type 4, which can cause tooth loss. And it's amazing, even kids, young adults, who you would think would not be suffering from this, we have found that almost 25% of young people suffer from some type of gum disease. Gum disease can affect all of your bodily systems. It's been proven that gum disease affects your heart, it affects blood pressure, it affects diabetes, and gum disease just has an overall effect on your entire body. So there are two types of gum disease we're going to discuss this evening. There's gingivitis, and then there are 4 types of periodontitis, 1 being the least serious, and 4 being the most severe, where it's actually very common for you to lose teeth on a regular basis. What are the causes of gum disease? Gum disease is caused by bacterial plaque that forms on the teeth. This plaque, I call them fortresses, locks in the bacteria and allows it to continue to work on your tissue without worrying about being removed. Because what happens is the bacteria works its way between the tooth and the gum, and it starts to cause a separation between the ligaments that hold your teeth in place, and it also builds a barrier behind it so that you can't remove it and it can continue working deeper, and that's what causes tooth loss. So there are other risk factors that cause gum disease to be more serious. Those risk factors include smoking and tobacco use. Whether it's regular cigarette smoking or smokeless tobacco, pipes, or cigars, all forms of tobacco have an effect upon your body and can reduce your resistance to this bacteria. So it is always recommended by the Board of Periodontists and by the American Dental Board that you cease using all forms of tobacco. So other factors include genetics. Some people are more predisposed by birth to gum disease. Also pregnancy and puberty. The changes in hormones, as you can tell by looking at any teenager who suffers from acne, your body has less resistance to bacteria when you have high amounts of hormones going through your body. So in the same way, gum disease works against you there as well. Other factors include stress, medications, and several other factors that we're still identifying even today. The common treatments for gum disease include regular dental visits. If you go and see your dentist twice a year, they can catch gum disease when it's in its very early stages. If you go to the dentist and see the hygienist and already have a more advanced form of periodontal disease, you may, like this gentleman we saw recently, who has infections. He has bleeding. If you were to touch his gums, they would spontaneously bleed. You can see the tartar and calculus and how his gums are red and inflamed, and there's pus in several places. Quite disgusting, yes, but when left untreated, this gentleman would be on a course to losing his teeth. And now that he's seeking treatment from the hygienist, she goes in and removes that tartar and calculus and allows healing to be promoted. So in this case, she's going to go in and do what's called a general debridement, and that's where you go along the surfaces of the teeth go below the gum line, you remove all that tartar and calculus using sonic equipment. And then she'll later do what is called root planing, where she'll go below the gum line and remove that tartar and calculus that already exists, where the gum tissue has started to separate from the teeth and allow the bacteria to go deeper and deeper. So she goes in, removes that, and that promotes some healing. And so the person can end up keeping their teeth much longer. So other forms of treatment, you can see the periodontist. The periodontist will do special procedures such as gingival grafts and crown elongation. And both the hygienist and the periodontist can use localized antibiotic. They can place the antibiotic directly on a pocketing area and remove the bacteria through the use of that antibacterial placement. You know, the key to success is home care. Home care augments what's being done in the dental office. If you do as the American Dental Association recommends, and you brush your teeth 3 times a day with a manual toothbrush, being sure to angle the toothbrush correctly and move in a circular motion, you can remove the tartar and calculus that's built up every single day before it has a chance to solidify. In the same way, you should also floss daily, and that will give you the greatest success. So in conclusion, gum disease is common. It is found in most of the population. The gum disease can be defeated with regular visits to the dentist, and it can be brought under control with regular home care, because that is key. So I want to wish you good luck in dealing with gum disease at home, and be sure to visit your dentist on a regular basis. Thank you.